Today, we will look at a company that is hated by value investors, hated by VCs, and hated by momentum investors. But weirdly, I got really passionate about this company, and I think they might all be wrong. Full disclosure, this is not investment advice. If you want investment advice, talk to your financial advisor, talk to your psychic, or whoever. This is just my opinion. Full disclosure number 2, I did a video about SeaStar Medical about 6 months ago. The price was similar to now, but all my predictions were wrong, okay? This is a much better analysis coming from the same person. Let's dive in. Okay, so here we are. This is slide 1. What's the approach? Which mental models apply to this company, to this analysis? The number 1 mental model is take the path less traveled. Okay, this is a small company. It shouldn't be public. In no way in hell should it be public. No VC is looking at it. No value investor is looking at it. No serious investor is looking at it. Okay, it's only retail guys like you and me. This is why it's an opportunity. Incentives of the relevant stakeholders. VCs are not looking at this. And you know why? Because they want to keep their job. And what do you do if you want to keep your job? You do the same shit everyone else is doing, okay? This is institutional investors. They're just doing the same shit everyone else is doing. Tikkun olam. The world is broken and living is a process of healing, okay? Our world is broken. Everything is broken. This company, no one is looking at it. Our job in this life is to heal. This is why I'm invested. It's part of healing the market, okay? This is a bigger purpose, a noble purpose. Heads I win, tails I don't lose much. The only way I don't lose much is because I don't have much money. Okay, there is a definite chance of a zero here. If we win 100x. If we lose, it could go to 0. So actually this one does not apply. What has my approach been? I have constantly tried to destroy the idea. Why is this not going to work? Why is this not going to work? And I can't find a reason it's not going to work for now. It might not work, but I can't find a reason. Please interrupt me because you're watching a YouTube video. You can't interrupt me, but instead of that, you can write a comment and I will respond to that, hopefully. I talked to VCs and their advice was look at the clinical evidence, look at the uniqueness, and look at the patents. And in addition to that, I have looked at the price. And this is taken from value investing. The price of the device for hospitals. So are they saving money? The TAM and the price of the company compared to how much profit they will make in the future. And lastly, the timeline and the problem. This is where the presentation starts. SeaStar Medical, calming the storm, compounding the capital. I'm gonna get rich with this, I think. Who am I? 4 years of investing, 6 years of passion for investing. I'm actually looking at 10 ideas per week. Yeah, this is my hobby. I am so weird, but it's fun. I like it. And on the right, you see a picture of me with my hero, Monish Pabrai. Monish. What is the problem? Every year, 700 kids have this thing called acute kidney injury plus sepsis, and they're put on a machine that cleans their blood, and 35,000 adults have this in the US. This is only in the USA, and 50% of them died. Okay, if you have this, there's a 50% chance of you dying. And of the survivors, 30% and more have to clean their blood multiple times per year. So it's pretty shit. What if instead there was a simple solution, a beautiful solution, where instead of dying 50% of the time, you only died 23% of the time. And you didn't have dialysis dependency if you survived. That's us. That's Quellimmune. This is the data that's been collected until now. 77% survival versus 50% survival of standard of care and no dialysis dependency. So is this actually going to work? What's the clinical evidence? So here you see, I don't know if you can see my mouse. I think you can see my mouse. The only study that's really important is the number 3. This device only works when you use something called citrate. In this study, they didn't use citrate in a lot of their patients because there was a national citrate shortage. In the cohort where they used the citrate, the mortality rate fell from 40% to 15%. So that's a 25% absolute drop. In a previous study, it dropped from 50% dying to 31.4% dying. So that's a 18.6% absolute drop, which is massive. It's massive. In the first China study, it dropped from 77.8% to 22.2%, which is incredible. Okay, it's incredible. If you want to buy this merch or this t-shirt, it's a SeaStar with a butt, you can head to my website, aloisgraber.com/shop. Here is more data. There was no dialysis dependence at day 60, and actually in all of their studies, okay? The kidneys recovered. They didn't have to get a kidney transplant, which is just look at the fucking data. Look at the data. The only thing is the data is too small to be significant yet. It is very promising. And this is why I invested. It's because I judge it to be a high chance of repeating in a bigger data set. So this is the current trial. Okay, 200 out of 339 enrolled, and reverse engineered, they augmented from 200 patients to 339 patients. And this means that there is an 80% chance of at least 15% absolute risk reduction, percentage point less chance of dying, or a 15 percentage point less chance of dialysis, which is mind-boggling. Okay, it's mind-boggling. And no one is looking at this. They're treating this like it's worthless to humanity, like it's going to die and it's useless. How does it work? Out of 10 patients, 3 are going to be predictable. 2 are going to be non-predictable. So if someone has a burn and is in complete inflammation, it comes as a surprise that the kidneys are failing. And he is coming in and the kidneys are already failing. You can't prevent that. He's coming in already sick. From the sepsis cohort, 3 arrive already sick. So you won't be able to prevent this acute kidney injury. And 2 are maybe some of them are preventable because you know they're going to have sepsis beforehand because they're starting to show early signs and they're not coming in too late. So all the drugs basically are focused on prevention and are not focused on when the kidneys are already failing, because a drug can't clean out your whole blood that is destroying your organs, okay? And so 65%, if we go back to the last slide, the 3 that arrived too late and the 2, so I don't know why I wrote 65%, 50% of the TAM is protected, okay? We don't need to worry about 50% of the TAM. 50% of the TAM is going to keep getting that sick and their kidneys are going to keep failing, okay? And this is what's important. Our TAM is protected. People are going to stay sick. I don't want them to become sick, okay? But as an investor, I need them to stay sick. No bad intentions here. If we could solve all the problems, that would be great, but this is reality. So uniqueness, stem cell therapy. What could stem cell therapy do? So again, stem cell therapy can only do so much. And you know what? Stem cell therapy would be so much more expensive than just this device that costs about $3,000 to produce. Stem cell therapy costs so much, in the hundreds of thousands. Google this and correct me, but it costs a lot more than the SCD. So even if it would get the same results, the SCD would have a competitive cost advantage. Trends. So which bigger trends are we part of? Here you see the population incidence of acute kidney injury per 100,000 people per year. And it keeps on going up, 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 up. So our market might actually be growing. And that's like this because people are getting older, their kidneys are weaker. Price. How much are hospitals saving? So in SeaStar Medical's analysis, they said hospitals are saving 69,000 every time the QuellImmune device gets used. They only have one device, okay? It's always the same. The QuellImmune is the one for children. 69,000 because the children are staying less days in the hospitals. So if they price it at 30,000, the hospitals can save 39,000. For adults, it's not the same thing because adults get displaced to recovery centers. So maybe for adults, they're only able to price it at 10,000. Management thinks it's 25,000 and 200,000 patients per year. I am extremely conservative and I say 10,000 and only 37,000 patients per year, which is extremely conservative. In that scenario, the system saves $300,000 long term. And you know why? Because there is no more dialysis dependency. Okay, if there is no dialysis dependency, you're saving like 100K per year. And then it costs 3,000 to produce. So for adults, it would be a 70% gross margin. For children, it's already a 90% gross margin. 90%. 90%. For adults, it's a 350 million TAM if it's 35,000 patients. For pediatrics, it's a 21 million total addressable market. So in a scenario where it's a 350 million TAM at a 70% margin, you're making maybe 250 million per year, and you're priced at a 10 times PE ratio, which puts the market cap at a 2.5 billion valuation. And those are very conservative numbers, okay? 10,000 per treatment per adult is not incredible, and 37,000 patients is not incredible either. So very conservative numbers. We get to 2.5 billion valuation, current market cap 20 million. It's 100x off. Really weird. No one is looking at it. Costs. The stock could go down 80% this year, and it wouldn't surprise me. It could also go straight up from now, like it has in the first 6 months of this year. They need to raise money. At the end of Q1, they had about 9.5 million and 11 million of operating expenses left for the whole year and 1.5 million of revenue left for the whole year. They're going to burn through their whole cash this year. And next year, my prediction is that there's going to be 14 million of operating expenses and 4 million of revenue. And revenue kind of completely goes to the bottom line since it's a 90% gross margin. And the reason why it's only 14 million operating expenses versus 15 million this year is that the trial costs are about 4 million per year. And then the adult trial is finishing at the end of this year. So next year, there might be 2 to 3 million in savings from decreased trial costs. 2028, my prediction is that they will break even if they have the same market penetration as they had in children in their first year, 1% of the market. This would make them have about, so from their 200,000 market that they said, they would have 2,000 people at 10,000 per head, which would make them have 20 million of revenue, which would completely put them in the black, out of the red. No crazy numbers. They need 8 million and they're going to issue stock for it. Now, the next question is, how many shares will they issue? Let's say they needed 10 million and the stock price dropped to $1. In that scenario, they would issue 10 million more shares. We are currently at 7 million with the warrants, and this would put us at 17 million shares. Now, if in the future they reach the 37,000 patients, and they make about 250 million per year, which puts them at the $3.3 billion valuation on 15 million shares, which is a bit less than 17 million, but go with me here. They have about a $200 stock price. So the current stock price is $5. So that's 40x off with very conservative numbers. The other thing is that they have invested already $150 million into this project. So if they were a private company, their valuation would never be 20 million. Their valuation would be at least 150 million. Okay. But because it's a public company and everyone and their grandmother has left this company, we're seeing what we're seeing. Okay. And this is a great opportunity. Come to me, come to daddy, come to daddy. Where is the most profitable sector for the general medtech market? The most profitable sector is actually class 3 devices, and SeaStar has been classified as a class 3 device. Why is that? If you have a class 3 device, you can't simply look at the previous product, say we're going to do the same thing as a competitor and just copy it after the patents have expired. No, you have to do your own trials and start from the bottom, 5 to 8 years. So even after the patents have expired, it's well possible that we have another 4 to 5, 6 years where they have a monopoly. Okay. It's very profitable. Okay. There are a lot of success story from class 3 medtech devices. When do their patents expire? 2032, 2031, 2032 is the date. We have about 6 years. If they start commercialization in 2028, they have about 3 to 4 years of execution in a monopoly market, which is plenty enough. The competitor won't be launching into an open hungry market. They will be trying to convince ICU directors to switch away from a deeply entrenched, highly trusted medical protocol just to save a few dollars on a device that already pays for itself via the insurance and ICU bed savings. So for a competitor right now, it would be completely rational to develop their own product. The rational thing to do would be to invest in SeaStar or buy SeaStar completely. But we don't want them to buy SeaStar completely because then we wouldn't get any of the upside. The adult trial was finishing at the end of 2026. The data for adults mid-2026, the approval will be end of 2027. And for the children, the post-approval study finished earlier this year. There is a good chance it will be fully approved at the end of this year. For the adults, there is also a good chance it will be in Q1 2028, where they will get the full approval. They might be late by 6 months. They might be late by 3 months. Does it matter? No, not really. In summary, this is a $3 billion company available for, I'm so sorry, available for about, if you take a $5 stock price and you assume 20 million shares, then it's 100 million. So $3 billion company for 100 million right now, which is 30x. And that's conservative because you know why? There is actually one last thing. They actually have the solution for septic shock. They have 6 breakthrough device designations. I was just talking about acute kidney injury, but they actually have a lot of other sicknesses that they can address and they are addressing. Okay. And the second thing is the analysis did not include the EU, Latin America, Asia, India, China, Africa. This is nuts. This is nuts. I was talking about a 30x conservatively if this works, but actually the upside is much higher. It could be 1,000x. It could be a 2,000x if we include the EU, Latin America, Asia, and the other breakthrough device designations. So SeaStar dies without investors, without stupid people like me who put 50,000 in. They die. They might or might not find some without us, because management, I feel like they're underselling themselves, or maybe the VCs don't want to invest in public companies, public VCs don't want to invest in small companies, and the patients die without SeaStar. So it's really sad. This was the last slide. I hope you enjoyed. Send me your questions. Don't do stupid stuff with your money. This is not financial advice. This is my opinion. Have fun. Have a good one. Goodbye. I have a lot of pleasure.